Also, the Prophet, peace be upon him, said that the khairun nas man yanfa'un nas, that the best amongst you is the one who gives benefit to others. You say, I'm assessing for danger. Okay? And I can see there is no danger and I'm okay. Yeah? No danger, I can proceed. Response. Let's say that his name is Naveed. Okay? Naveed, can you hear me? You see, I'm checking. First of all, I know he's not alert. So I'm first responding, is he responding to voice? So if he responds to voice, I know his airways are open as well and he's breathing. Okay? So 3 for the, क्या कहते हैं, do 1 and get 3, whatever. And he's responding. Now the next thing I do is shake. Naveed, are you okay? He's not responding. He's unconscious. Now I shout, help! Help! Help जोर से पढ़नी है, ऐसे नहीं जैसे हम दुरूद पढ़ते हैं किसी को पता ही नहीं चलता, तो जोर से हेल्प हेल्प. और अगर कोई बंदा खड़ा है तो खामखा गला ना फाड़े, कॉमन सेंस. वो खड़ा है तो और किसको हेल्प, वही ना हेल्प करे वो और उनको बुलाने चला जाए. सो डेंजर रेस्पॉन्स, ठीक है. ही इज अनरेस्पॉन्सिव. आई शाउटेड फॉर हेल्प. Now I need to check the airways. What did I tell you? To check the airways and till chin. What happens is that when you fall back unconscious, your tongue drops back. Because your muscles come relaxed and your tongue is blocking the airways, not anything else. There may be a foreign body, but that's choking. That's different. You will deal with the choking later on. For this person, you know, he's not choking, but the tongue could be blocking their airways when it's fallen back. So you do head tilt, chin lift. ये तो dummy है, इसकी chin drop. If someone's unconscious and you do their head lift here, jaw will open. So the tongue will remain where it is. So you do chin lift. And these are 2 things you need to do to say that you have addressed their airways. And I can tell you many times in hospitals this has happened. Elderly patient lying on bed, stop breathing. You do head tilt, chin lift, because they've gone drowsy, unconscious, tongue is blocking the airway. Head tilt, chin lift, patient starts breathing.
So do that to move up when you...
Yeah, I'll show you a picture of this as well. Airways done. Now check for breathing. Like I said, the 3 things you're gonna do. Put the ear next to the nose, feel the ear touching you, and then look at the chest and count for 10 seconds. Okay? समझ आ गई? So that airway is still open. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And in this scenario, the patient is breathing. Okay? In this scenario, the patient is breathing. So they are not alert, they are unconscious, but they are breathing. बंदा बेहोश हो गया लेकिन सांस हिलना लगेगा. This is the scenario so far. Understood? Any no severe head injury, and you're making sure no other fractures. The fracture one, you will kind of feel the whole body. Okay? And so with the head, now look, how do I need to treat him as a human being? So I've told him, I'm Dr. Zirik, I'm first aid trained, or if it's you, then you tell them what you need to tell them. They're reassured, and even though they're unconscious, look, the brain's still working. You know, when कभी बेहोश होते तो पता चलता है हाँ ये कह रहा था, ये कि वो उसने मेरे गला ये बात की, ये पता है. So their brain still working, so that's why, so you need to tell them what I'm going to do. Kaisar bhai, you're going to be okay, I just need to have a feel of your body, yeah? So I'll be touching you, don't worry, it's just to see that everything is okay. If anything causes any pain, let me know. Okay? So I'll obviously make sure that his imama topi is off, and what I need to do is just check for any visual blood loss or anything, and then just have a feel. And, just a gentle touch. And if there is a head injury, then there's going to be a depression. Yeah, Gruma. You know gruma, in a hematoma in medical terms. So blood is either collecting in the skin outside or it's going to go. So if there is a depression, fracture ho gaya, and you can feel that the counter will be, you'll feel the depression. और निकियां बच्चियां ने जिला करो तो था भी कुछ होना है पता कुछ कितनी glabella. So you will feel a depression like that because there's still skin intact. Your skin will be open. Okay? You'll have to have gloves on. First aid kit which gloves on. The second most important thing that you're going to do is look into their ears. Is there anything coming out of it? If there's any fluid coming out of it, that's sign of serious headache. So if there was a depression, you fracture in the skull or anything coming out of the ears, straw-like fluid. This is a fluid that surrounds the brain. Do it this way as well. अगर कोई fracture है या नहीं. Just have a feel of the chest. Is there any rib fracture? Okay? And then just feel of the tummy in about 4 places. If there's any internal bleeding or the tummy is bloated or something like that. And again, it's all to do with the history. And again, with this. With the legs, look, his legs are in normal position. You have to know what is normal position to identify abnormal. So if he has had a fracture, then either the muscles will pull the leg up, which means one leg will be shorter than the other. Anyway, the one that is shorter, the bone's broken, the muscles have pulled it. Or, depending upon where the fracture was, either it may be turned outwards, turned inwards, or completely So if there is a fracture, you're not going to move them. But in this case, he has no fracture. He has no serious head injury. So I'm going to put him in recovery position. So I'm going to demonstrate to you the recovery position. Recovery position is what you guys will practice with each other. Acha, recovery position, 3 steps. Kitne? 3 steps. So number 1, you need to move this arm out of his body, because when you will roll him towards you, then so kaisa, I'm just going to put your hand this way, okay? Now, sometimes kusa doesn't have to be at the right angle. Yeah, no. Just keep this arm out of their body. The other thing is, have you got anything in the pocket? Yeah, you got mobile phone. I'm just going to put it on a side, because if I roll you over, it's going to really hurt you. And that's something very important. It will cause them pain. So I'm just going to put your knee up. Step number 2. So step number 1, arm. Okay, step number 2, make sure there's nothing in the pocket on this side. Again, it's a human touch. Clear so far? Easy. The next thing you do is, you take his hand, put it on his cheek, and you support it. Why? Because when you are rolling his body over, you will be supporting his head through that. And you secured his arm as well. Okay, so just move a little bit back. So I'm just going to roll you towards me. So Sara control it, and then he's still not fully stable. He could roll back. So what I do is that way. इतना सराहना बंदा रखी छोड़ा बच्चियां ना इतना नहीं होना बड़ियां ना body shoulders get bigger, so there is a lot of so clear so far. Now, very important thing, okay? That is his head is his airways in the good position? So head tilt to keep the airways open, and you need to keep assessing his breathing, because although he's breathing at the moment, Few minutes down the line, he could not be breathing. Then he's breathing until the ambulance comes. There was an incident. A young girl in the swimming pool. She had whatever cardiac arrest or whatever, and people who were first aid trained there, they assessed her. She was breathing, and they put her in recovery position. In essence, she was taking her last breaths. Recovery position, ambulance bulai, not monitoring, ambulance came, they said she's dead. And because she was breathing and there was no other evidence of any injury, so they took their time. So again, it's a real case. I don't know how long it was. The girl died. And it was a serious case. So remember that. Make sure that you check the breathing. Okay. Now, stop. So now you need to do chest compressions. See how I do it. Try to copy it. Okay. Again, you need to make sure that their chest is exposed. You know, in the first aid there will be cloth cutters. So cut the clothes because you need to do things on bare chest, because when the defib comes, you'll be attaching the pads of the defib as well. So chest exposed. And if someone said Islamic sisters, make sure कि आगे पर्दा है गैर जरूरी लोग नहीं हैं.
If you're wearing like thin clothing, it doesn't matter.
No, it's always exposed. So sometimes when you expose them, there may be an injury that you need to look into. But if it's a small injury, patient's unconscious, not breathing, you need to get on with the CPR. So pulse in the past, many years ago, you were to check the heart rate, you were supposed to check the pulse. It's no longer the case. If they, just like you said, they call the ambulance and say they're not breathing, yeah, don't need to say unconscious, which is a valid point. Okay? Similarly, if they're not breathing and unconscious, their heart has stopped. So why should I check for their pulse? There's no need for pulse. But the blood is still trickling through because of the pressure in the body. And you need to address that, because when you will be doing the CPR, the blood may still be. So catastrophic bleed, someone else dealing with it while you do the CPR, and ask them to put the pressure on. Does that answer it? Remove the confusion, or still confused? Okay, thank you. But if it's still, I don't mind, you know, until I can help you remove the confusion. So, so this is the casualty, okay? And I need to do chest compressions. My dominant hand has to be on the patient's chest. So if I'm right-handed,
do the head tilt first or no?
not for the time being, no need to head tilt chin lift, okay? Because that's done and dusted. At the moment, you're just going to do the compressions.
Okay.
So my dominant hand, if I'm right-handed, then my right hand goes there. If I'm left-handed, because you want the biggest force, middle, you know, the bottom middle of my palm, put your fingers there, everyone. That needs to go onto the center of the chest. So one center vertical, and then another center from armpit to armpit. So if this is the line from armpit to armpit, and this is the central line where they cross, put the finger there, and then this goes over there. Arms straight, no bending, no side, straight, so that your body force goes straight through. My non-dominant hand, finger interlocked. Now I move my body at right angle, so that my body is pushing my hands down. So this is very important, okay? So place dominant hand, arm straight, right on top of the. If you need to adjust your legs to make it properly, do that. How deep you need to push. These dummies have got a mechanism that when you hear this click, then that means you pressed enough. If you don't hear a click, you're not pressing enough. Now when you press, sometimes you may not release fully. You have to release fully as well. Let it come up properly as well. So And that's the pace. It should be about 100 to 120 compressions a minute. I'll be observing you guys, and where I feel someone's slow, someone's fast, I'll be telling you, and you just adjust your speed.
So is it no longer 30 and then...
No, I'm going to come to 30. At the moment, I'm just talking about the speed. So what
Okay.
should be the speed of compressions? Okay? So what you do is, you do 30 chest compressions and then give them 2 rescue breaths. With the rescue breaths, head tilt, chin lift, because if the airways is blocked, it opens up. You pinch their nose. Okay, before you do that, you clean it.
In the first aid box, you'll have that tube thing on.
Yeah, and you can have those face masks for yourself, or there is a face shield in the first aid kit. There's a face shield, so you can put that on there. So you need to pinch the nose and lips around the lips, and 2 puffs. Puff is for an adult. It's a baby, but now otherwise you're gonna cause an injury to the lungs and holes, and that would be another problem. So puff is not. And every time after one breath, take your mouth away, and So that's what you will do, and then you need to see the chest rising. These dummies are very clever. If I do it this way, chest won't rise. It's Wallah. So head tilt, chin lift is very important, okay? And in reality, that's what's happening. The tongue is blocking. So you may be giving them breath, but nothing's going in. So now I'm gonna demonstrate to you 32, 32, huh? 1, 2, 3, 4, 5, 6. Oh, Ian 30, who was counting? And you are all keeping an eye on me. I took a breath as well, because the fresh air that I need to put in there. No, Muslim.
तीसरा नीचे जो है वो तो मेरे तरह है मैंने उनकी ribs it's painful, it's very
Rib broken, then my life is okay.
What about for babies, 101 years?
Yeah. What I'll do is,
Yeah.
पहले ये करो, हर वाली point ना कोई अगले point good, you're eager, I like that.
Just a research
वो
के
right time है. ठीक है.
मनठार कराची दा अतार बड़ा सोना 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 सरदार बड़ा सोना
Okay, stop. When it says do not touch the patient, no one's touching the patient.
And then you...
This is saying shock advised. Now you need to make sure everyone's clear. Check everyone's clear.
You have to shout as well. Clear!
Liver shock, now press the orange button. Right, the pin didn't jump, but so start CPR. Now you follow his instruction. Someone else start the CPR. Okay, someone else and do the CPR. Look, you have to continue 32, 32. 2 breaths we did. At the moment down, but you should continue with 32, 32, 32. Then you stop.
Can you do your job?
Okay, stop now.
No shock advised.
So it's saying no shock advised because the heart has.
Start CPR.
Now it's saying if needed, start CPR. You now need to make the decision. Is he breathing or not? Check the breathing. Head tilt, chin lift, and check the breathing. Because with breathing you have to do head tilt, chin lift. Excellent, mashallah, thank you. Chalo ji, dua pado.
And there's a child in it. We put one hand at the back.
कूड़ा महल चढ़ाया साया देखो न अतारी नो
You carry on. Okay, you need to put one on the front. No, that for a child is on the front. Middle of the chest.
बेशक मैं को जहाँ
One at the back.
बड़ा सोना
It needs to go back at the middle. In the middle, isn't it? Back in the middle, yeah. Okay.
ए तन मेरा चश्मा हो मैं मुर्शिद वेख न रज्जा हूँ लूलू दे मुड लख लख चश्मा हिक खोला हिक कज्जा हूँ ऐना डिठिया मैनू सबर न आवे मैं होर किदे वल
Keep your arms straight.
बज्जा मुर्शिद दा दीदार ए बाहू मुर्शिद दा दीदार ए बाहू सानू लख करोड़ा हज्जा
Then you say assessing
जेड़ा तकदा इक वारी ओ तकदा जांदा है जेड़ा तकदा इक वारी
Shock advised.
मेरे सोने सोने मुर्शिद दा मेरे सोने सोने मुर्शिद दा दीदार बड़ा सोना
And I'm asking him to keep coughing. And he's no longer able to cough, right? So I need to tell him that I'm actually going to smack you in your back, okay? So now he could fall because his breathing is not and go unconscious. So in a way, so I need to have a wide and secure base. And I need to ask him to lean forward and support his body. Okay? And then, like in between the two shoulder blades, and a good whack. And a good whack, and then like that. Like it gives you good momentum. Sometimes people just leave it there. It does work. I'm not saying it doesn't, but the way I'm telling you, keep it like a arc, and you hit them. After every time you look, as they come out, so if they've done after 5, it doesn't come out, you do abdominal thrusts. Now, make a fist, all of you make a fist with your dominant hand, non-dominant hand. Okay? Now, this area, it needs to go between belly button and the bone, somewhere in the middle. Put it there. Put the dominant hand on top. Now what you need to do is, so you are behind like from this way. Okay? Make sure you keep your head to the side. So in and up. So do these in and up. Proper with good force. In and up. As a jerk. Okay? So up to 5. Up to 5. So after each thrust, you look, has it come out?